fair and respectful discussion. I would also urge you to observe the time limits for your interventions. This will be key to ensuring a balanced and effective discussion. I also thank you in advance for your patience and indulgence when I will suspend the meeting to consult with the Secretariat when needed. I know that Director General Dr. Tedros is also attending this session. Dear Dr. Tedros, I will now give you the floor for some opening remarks.
Thank you. Kluge, dear colleagues and friends. Yesterday, I returned from spoke with health workers of health who are on the ground discuss the health situation and how WHO can best support the Ministry of Health to deliver care in sustained care for throughout Ukraine. As a child, I experienced the smell, sound, and the has brought back those very painful of fear, pain, and loss. I know the horror and wish for peace to return. I saw extraordinary resilience of their loved ones, their homes, their security, but have not lost hope. I saw the damage to health structure and heard the accounts of physical harm to health workers. Has now verified 200 attacks on health. Should never be. To prepare scenario. Supplies in hospitals has delivered trauma and emergency supplies for youth surgeries and healthcare equipment to serve 650,000 people. Have also provided and health facilities. Yesterday, while I was there, handed over 20 ambulances supported or in Ukraine and of Ukrainian healthcare casualties. We have also established 3 health hubs in Western Ukraine to support medical evacuations and ensure safe medical evacuation of patients, including those suffering from cancer, for treatment outside Ukraine. Some of our Ukrainian staff have lost their homes, deal with daily uncertainty, but have kept working to support the health needs of the people of Ukraine. we can to protect them. While I was in Ukraine, so from headquarters, the regional office, and the country office working together. So glad to witness the effectiveness of the three-level alliance. There is one medicine that WHO Ukraine needs more than any other, and that peace. I thank.
Thank you, Dr. Tedros. Before moving to the first subsection on the agenda, let me hand the floor to Regional Director for some opening remarks from his side. Dear Hans, the floor is yours.
Thank you, Ambassador Sianoki. Good morning, and thank you for joining this special session of the WHO Region Committee for Europe. These are dark times for the European region. We are confronted with unthinkable levels of human suffering. Long shadow cast from over 2 years of a pandemic, we are now experiencing war and the greatest humanitarian crisis our European countries have experienced for more than 70 years. The direct impact of the conflict after 2 months is appalling. At least 3,382 civilian deaths, among which 75 girls and 91 boys, and 69 children whose sex is yet unknown. 13 million people displaced, and 16 million people in need of assistance. In Kiev in January this year, we were scaling up with the Ministry of Health our joint response to the unprecedented outbreak of vaccine-derived polio, rolling out COVID-19 vaccine programs, and attending 2,000 severe COVID patients in its hospitals, making fast progress on primary healthcare and financing reforms under Minister Lashko's inspiring leadership. As we speak, the few hospitals still functioning are attending life-threatening burn, bullet, and shrapnel injuries, with many unattended at home or in the streets with these injuries, or with tuberculosis, depression and psychiatric disorders, diabetes, HIV, COVID, and cancer. 40% of households have at least one member in need of chronic treatment that they can no longer find, resulting in an estimated at least 3,000 premature avoidable deaths. With almost 200 health attacks verified and documented by WHO on the ground, Ukraine sees the largest and quickest assault on the healthcare system, its workforce, and its patients. Beyond all what has been said already, beyond the firmest condemnation for these acts, I need to say that nothing is more destructive to health than attacking it upfront. Hospital destroyed by an earthquake will be rebuilt, retrofitted with hope. But hospital bombed by the will of someone will be forever lost, marked with stigma and infamy, and feared from the public. It is a breach of international humanitarian law. We will also see the long-term health impacts of the war unfold. Missed vaccinations for children, treatment gaps for cancer and chronic conditions, shortages of essential medicines, food insecurity, economic uncertainty, psychological trauma, increased sexual and gender-based violence, health workforce burnout, effects of this conflict will cascade down through generations to come. I firmly stand beside the United Nations Secretary General Guterres in urging all parties to enact an urgent and immediate humanitarian ceasefire. The safe and secure functioning of humanitarian corridors. Help evacuate civilian residents and also deliver life-saving humanitarian and medical assistance. And with the UN Secretary General, I also believe that health and humanitarian principles remain the key drivers of peace, and WHO holds a unique position as a peaceful arbitrator for health, representing the interest of all people in all member states. Good health comes with unity within and across borders. As a doctor myself, I felt compelled to be in Ukraine again on World Health Day in April, to stand in solidarity with healthcare workers in the country. I thank them for their dedication and professionalism as they continue to deliver care in the face of human suffering and in scenes of total devastation that nurses, doctors, midwives, ambulance drivers, pharmacists, therapists, or social workers, by commitment to their profession, are forced to witness and experience. I was very moved by the dedication, passion, and resilience of them all, battling to deliver healthcare. I was equally overwhelmed when I visited in the early days war-affected areas and met with internally displaced migrants and refugees in Poland, Moldova, and the Czech Republic. The President of Moldova asked me to convey to step up our support to the country, which has disproportionately received a lot of Ukrainian people, which are welcomed in Moldova with open heart, alike in the other European countries. Right now, our team is on the ground, serving the health needs of evacuated people from Mariupol. And on this Saturday, I will be joining the team in Ukraine when I travel to Kiev and war-affected areas, which could not be visited earlier, to meet people, patients, and frontline workers to further adapt and scale up our response, and to agree with the national and local authorities and non-governmental organizations on how WHO can support the recovery plans to build back better. NGOs have a capital role in health in Ukraine, and I respect them a lot, having worked myself with Médecins Sans Frontières during 2 wars. WHO is committed to being in Ukraine, both now and in the longer term, addressing immediate health challenges and supporting the future reconstruction of the health system. With national authorities and over 100 local, national, regional, and global partners, we are working night and day to respond to the immediate health needs of every single person affected by this humanitarian emergency in Ukraine and in the countries, welcoming those fleeing the fighting. We are now redeploying our teams throughout the country as access and security improves. As is stated by our WHO Constitution, quote, "The health of all peoples is fundamental to the attainment of peace and security and is dependent upon the fullest cooperation of individuals and states," unquote. I am sure that all of us gathered here today as people and professionals who have dedicated our careers to protect and promote the health of the people we serve, and who respect the sanctity of human life, are deeply concerned about the repercussions of the war in Ukraine to the whole region. Health and humanitarian principles, coupled with a pan-European unity and spirit, remain, as I said, key drivers of peace. Today, we need pan-European unity more than ever, in line with the motto of the WHO European Programme of Work, United Action for Better Health. If that progress can and must still be made through engaging in constructive dialogue. And I commit to you that especially in these dark times, no one will be left behind. It is with these principles in mind that I call on all of us to approach the debate today. We owe that to every child, every woman, and every man that we serve. Thank you.
Thank you, Hans, Regional Director. And also thank for Dr. Tedros for very thoughtful words you delivered. Let us then move to the first sub-item of on the agenda. For this, I refer to the document you see on the screen now. Following the formal request that was made on 28th April by 43 members of this regional committee, the regional director consulted with the president of this regional committee and with the members of its 29 standing committee to decide on the date and format for this special session that had to be called under Rule 5 of the Rules of Procedures. To a written silence procedure, the 29th Standing Committee decided that given the urgent request for convening this special session, it should be held virtually on the dates that were originally reserved for the third regular session of the SCRC 10th to 11th May, for which interpretation has already been booked. As for the previous sessions of the Regional Committee in 2020 and 2021, special rules and procedures were needed to accommodate the virtual nature. As indicated in the document, the draft special rules that are submitted to you are based on the ones that you adopted at the 71st session in September last year. They were circulated last week, Thursday, 5th May, with a request to flag any concerns members may have. No comments or concerns were received. Before we proceed to the adoption of these special rules, I will ask the legal counsel to brief highlight the main contained in these special rules and procedures. Legal counsel, Mr. Derek Walton, the floor is yours.
Thank you, Executive President, and good morning to everyone. As you'll be aware, if you've been attending any of the virtual meetings in WHO in the last couple of years, in order to hold a virtual meeting, we put in place certain special procedures to make the necessary adjustments to the rules of procedure to allow the meeting to go ahead in an orderly way. And that's what you see before you in the special procedures document that you have. These do not replace the rules of procedure for this meeting, which remain in force, but they do clarify, supplement, and in some cases amend them where this is necessary to enable our meeting to go ahead in a virtual format. They're based on the special procedures that you used in this regional committee last year, as well as on special procedures that were used for the World Health Assembly last year also. I won't go through them in detail, but I would like to highlight a few of the main points of them to you. The first is that it makes the necessary changes to allow participation to be virtual, and your virtual participation will count towards the quorum that is needed to make our meeting valid. In terms of addressing the regional committees, some changes are made. Live statements are to be made by the member states, but you also have the opportunity as member states to make a written statement either instead of or as well as your oral intervention. Others, including states that are not members of the regional committee, invited representatives of the United Nations, specialized agencies and other regional international organizations, and non-state actors in official relations with WHO or accredited by the regional committee, you will have the opportunity to make written statements only. In terms of the right of reply, as you've already heard Rob Butler explain the way to signal your intention to make a right of reply or to raise a point of order. But I just want to clarify that the special procedures provide that if you want to make a right of reply to an oral statement, you should do so orally. Please use the hotline number or the email address to signal your intention to do so to the Secretariat. That will be brought to the Executive President's attention, and you will be given the floor to make your right of reply at the end of the meeting. So if you ask for the right of reply this morning, you'll be given the floor at the end of our morning meeting. If you wish to make a right of reply to a written statement, you should do so in writing, and you have 5 working days from the closure of the plenary session in which to do that. Perhaps the biggest change that the special procedures bring is to the way we make decisions. Of course, as is our normal practice, the default is consensus. We should do everything we can to reach a decision by consensus. However, in the event that a vote is required, the special procedures provide that this can only take place by way of a roll call vote, which would be conducted through the virtual system. And there is a document, Inf Document 3, that sets out the details of how such a roll call vote would be conducted if we get to that point. Explanations of vote can be made orally or in written form, but please remember that only those who are not sponsors of a resolution may make an explanation of vote unless the resolution has been amended. So those are the main points of the special procedures that you will be adopting if you choose to adopt them, as the President will shortly invite you to do. Thank you very much.
Thank you, Legal Counsel, for this clarification. Let me also add 2 points in this context. Rule 3 of the Regional Committee's Rules of Procedures requests member states to provide credentials before the opening of the meeting. In accordance with paragraphs 12 to 13 of the Special Rules of Procedures, the credentials have been submitted electronically. In accordance with Rule 14 to 10 of the Rules of Procedures, the 29th SCRC confirmed through a silence procedure the composition of the Committee on Credentials, composed by the Chair, Vice Chair of the 29th SCRC, and the Chair of its subgroup on governance. This committee met yesterday, and in the report that was communicated to me, concluded that all submitted credentials by 50 members of this committee meet the established requirements. I also refer to the provisional list of participants that is published on the website. I thank all member states for this effort. Based on the information received from the Secretariat, I can also confirm that the quorum required for this session by Rule 22 is obtained. I take it then that the Regional Committee is willing to adopt the draft decision contained in EUR/RCSS/conf./1 Special Rules and Procedures. So I see no objection. The decision is therefore adopted. Let's then move to the next sub-item, adoption of the provisional agenda. This sub-item, the relevant document is the one you see now on the screen. As you can see in this document, in line with Rule 5 of the Rules of Procedures, there is only one agenda item for this special session today, apart from the opening and closure of the session, of course. This relates to the subject matter that is contained in the formal joint request that was sent to the regional director. As you know, under this single item, a draft resolution has been submitted under Rule 22 bis, supported by 36 members of this committee. Please also note that with only one agenda item, no program and annotated program have been supported. I will now read the countries which have supported their draft resolution. Ukraine, Australia, Belgium, Austria. Yeah, Ukraine, Austria, Belgium, Bulgaria, Croatia, Cyprus, Czech Republic, Denmark, Estonia, Finland, France, Germany, Greece, Hungary, Ireland, Italy, Latvia, Lithuania, Luxembourg, Malta, Netherlands, Poland, Portugal, Romania, Slovakia, Slovenia, Spain, Sweden, and the United Kingdom of Great Britain and Northern Ireland. At this point, I would also make a chair's proposal to grant the EU delegation observer status in this special session and invite them to attend and participate without the right to vote in meetings of committees and subcommittees related to the present special session of the regional committee, as well as in the drafting groups and other subdivisions addressing matters falling within the EU competence. So this has been a long-standing practice. I therefore hope that this is accepted by the members of this regional committee. Okay, so there have been also some number of other countries who have also supported the draft resolution. I would like to add the name of those countries also to the list I just finished before taking the EU observer status. So these countries are Albania, Andorra, Monaco, Moldova, Iceland, Norway, and Turkey. I suppose now I have the complete list of the countries who have been supported the resolution. Okay, thank you, Secretariat and Legal Council, for this support. Now I would like to go to the adoption. So are there any delegates wishing to speak at this stage? Okay, so I see that Russian Federation has raised their hand. So, delegate of Russian Federation, you have the floor.
Madam President, dear colleagues, we are ready to discuss the humanitarian crisis in the Ukraine, but we oppose the draft resolution as worded, suggesting a link with an aggression conducted by the Russian Federation. We consider this is improper.
Please, delegate from the Russian Federation, could you please repeat what you just said, that we can apprehend and understand it correctly? Please, could you repeat?
Madam President, dear colleagues, good morning. We are ready to discuss the humanitarian crisis in the Ukraine, but we are opposed to the wording of the resolution and of the agenda for today.
Thank you, delegate from the Russian Federation. You have the possibility then to comment the resolution when we come to the discussion of this, and let's then have the discussion there about this. But thank you for taking this up here. I assume that we can now go further, and do we see other member states that are like to have? So I see no objection. So the agenda is therefore adopted. This concludes agenda item number 1. Let us then move to the item 2. Consideration of the subject matter contained in the letter to the WHO Regional Director for Europe of 28 April 2022, signed by 43 member states. I also assume that I can invite of the EU delegation adopted here. So I confirm also that participation of EU delegation. And now to the agenda item number 2. For this item, I refer to following relevant documents you can see on the screen. Before I open the floor for discussion, I first would like to invite the Regional Emergency Director to first report on the subject matter that is raised in the joint formal request, namely the impact of the Russian Federation's aggression against Ukraine on the health conditions in Ukraine, as well as its consequences in health matters within the European region as a whole, and on international health matters which have wider than regional significance. So, I give you the floor now, Dr. Gerald Rockenschaub, Regional Emergency Director. Please, your turn.
Thank you very much, Madam President, Excellencies, Director General, Regional Director. Much of the details have already been said by the Director General and the Regional Director, but let me maybe start with saying that it is exactly 3 months since the Regional Emergency Program was on a mission in Kiev to discuss with our country office scaling up capacities and doing scenario planning. And 1 week later, on 24th of February, we indeed saw a drastic escalation of the humanitarian situation in the country. What this scenario planning allowed us is pre-positioning of supplies, as the Director General already mentioned, which put us in a position that we could quickly mobilize life-saving medical supplies, trauma supplies, and work very closely with the Ministry of Health on our immediate priority to enhance life-saving interventions and to build a pipeline of medicines and trauma supplies. 398 metric tons have been mobilized so far of life-saving supplies. 167 went down to the oblast level. I would also not deny that in the early stages, we had substantial challenges. We had to evacuate, to relocate our staff, and staff security and safety was an immediate priority. And then gradually to rebuild our presence, starting from a temporary office space in Lviv, now expanding the footprint towards Kiev, Dnipro, and other operational bases in the country. Our focus is at the moment on coordinating the humanitarian health response. We're working very closely with partners, have mobilized 50+ emergency medical teams. GOAN, Global Outbreak Alert and Response Network partners are in the field. And the health cluster, as part of the humanitarian architecture under the overall leadership of the humanitarian coordinator and UN OCHA, is coordinating with 97 health partners on the ground. At the same time, as the regional director mentioned already, we're trying to bridge the humanitarian health interventions and work very closely with the Ministry of Health under Minister Liashko's leadership to already look at health system recovery and reconstruction. Some of the public health priorities, and they are indeed grave and severe, that the needs that we are trying to cover are looking at scaling up the surveillance capacity. We had a relatively modest vaccination coverage for COVID-19 with 36% immunization rate across the country. We had relatively a challenging situation with measles coverage. We had a polio outbreak. We had a cholera situation in the past with the destruction of water and sanitation infrastructure. Obviously, the risk for communicable diseases is substantially increasing, and we are working closely with our partners to have early warning systems and response systems in place. Another priority, obviously, health information, to share adequate health information, from attacks on healthcare to other relevant health information with partners and the international community. We are constantly updating our public health situation analysis, both for Ukraine, but also for neighboring and refugee receiving countries. Let me also emphasize that protection issues, the prevention of sexual exploitation and abuse, is taken very, very seriously by the regional director and by the Director General. And we are in the process of building a very robust system to prevent and do the utmost possible to protect the most vulnerable. Another priority is obviously non-communicable diseases, mental health, maternal and child health, particularly for those patients that can no longer access highly sophisticated treatment, cancer patients, dialysis patients, other severe diseases, we are working very closely with EU countries who have established a medical referral system to ensure that those patients can be referred to EU countries, to appropriate facilities, and have sustainable treatment available there. We have also mobilized our support to help neighboring countries. We have established a field extension to coordinate and mobilize technical support to the neighboring and refugee receiving countries in Krakow. And we have scaled up our country office capacities in those countries to be able to address public health concerns and work with governments to ensure that those Ukrainians who had to flee their country can receive health care and have their health needs addressed. Let me also thank our donors and partners. We have so far received $46.5 million for our initial response. And we have just yesterday launched yet another appeal asking for another 80 million for Ukraine to scale up and maintain our response capacities there, and for 67 million for neighboring countries support. Let me end with saying that these resources are well invested. They will serve us to help the most vulnerable on the ground. I thank you very much for your attention.
Thank you, dear Gerald. And as I have heard from Director General, from Regional Director, and now from the Regional Emergency Director, I clearly hear that you work in a very good coordinated manner, supporting each other there on the field, and also other organizations, UN organizations and NGOs who are working on the floor, and that is much respected. I apologize. I obviously went too quickly to the adoption of previous agenda item because I see active hand from Russian Federation. I did not take into account the time it takes for the interpretations. So I will act a little bit better than in next agenda items. So let's go back to the previous agenda item so that member states then have the possibility to say what they want there. And I would like to read then one paragraph to remind us what was the subject item there. So at this point, I would like to also make a chair proposal to grant the EU delegation observer status in this special session and invite them to attend and participate without the right to vote in meetings of committees and subcommittees related to the present special session of the regional committee, as well as in any drafting groups and other subdivisions addressing matters falling within the EU competence. So this has been a long-standing practice, and I therefore hope that this is accepted by the members of this regional committee. So that was the thing I wanted then to highlight in previous under the previous agenda item, which I now opened again, and now give the floor for the Russian Federation with your active hand. So please, the floor is yours.
Madam Chairperson, colleagues, once again, I would like to express the fact that I am not in agreement with how the agenda has been formulated. We are categorically against how it has been worded, how this humanitarian and medical situation has arisen in Ukraine because of the aggression of the Russian Federation. This is not something that should be included in our agenda in this formula. Thank you.
Okay, so I understand that I went too quickly. Also, that part of the adoption of the agenda item. So there is then possibility, if that is okay for everyone, that we adopt the agenda item as noted, but we then also note the comment that came from Russian Federation. So would this be okay for everyone, also for Russian Federation?
Да. Уважаемые коллеги, предлагаю...
Colleagues, we suggest that we take the wording out of the agenda that says health emergency in Ukraine and neighboring countries stemming from the Russian Federation's aggression. So we feel that these words stemming from the Russian Federation's aggression, if we cannot take those words out, then I think that we will have to move to a vote on this topic.
The words that I heard from Russian Federation are not included in the wording of this agenda item, and I would like to read now it through. So it is here that consideration of the subject matter contained in the letter to the WHO Regional Director for Europe of 28 April 2022, signed by Ukraine, Albania, Andorra, Austria, Belgium, Bosnia and Herzegovina, Bulgaria, Croatia, Cyprus, Czechia, Denmark, Estonia, Finland, France, Georgia, Germany, Greece, Hungary, Iceland, Ireland, Israel, Italy, Latvia, Lithuania, Luxembourg, Malta, Monaco, Montenegro, Netherlands, North Macedonia, Norway, Poland, Portugal, Republic of Moldova, Romania, San Marino, Slovakia, Slovenia, Spain, Sweden, Switzerland, Turkey, and the United Kingdom of the Great Britain and Northern Ireland. So this is the wording I suggested then that we could adopt. That be accepted.
Да, уважаемый председатель, мы поддерживаем...
Madam Chairperson, we maintain our position about the wording where it says health emergency in Ukraine stemming from the Russian Federation's aggression. We still maintain our objection. Thank you.
Agenda item wording doesn't include those words.
Да, в начале выступления...
In the beginning of the statement, we heard this wording as being part of the agenda item when you read it out earlier at the beginning of the meeting.
Okay. Would have included those words also. So when I now read recently the agenda item, it does not include anything else that I read recently. So therefore, if that is then okay, that we adopt this agenda item. Good. Okay. So I assume that we can adopt the agenda item with those wordings I read recently. Good. And now, can we now go back to the agenda item 2? To begin then the general debate there. Is that okay for everyone? Thank you for your understanding. And I again would like to thank then Regional Emergency Director Gerald Rockenschaub for your explanation. And also the comprehensive report and for your leadership in these most challenging times. Hope you have also time for sleep. I acknowledge the regional director has taken the response to the health needs as consequences of the war in Ukraine as his top priority. And I commend him for his swift mission to the field, namely to the Polish Ukraine border, to Lviv on the World Health Day as a sign of solidarity with the Ukrainian Minister of Health, the frontline workers and people of Ukraine. I also heard from Director General that there has been recently visits from his side also to this field. And I understand that Dr. Kluge will leave at the end of this week to Kiev, is that right? And war-affected areas to further intensify and adapt the response, speaking to patients, health workers, NGOs, and to agree with the authorities or WHO's role in the recovery to build back better and greener. Okay, and as noticed, we have to take this discussion then so that I also remember to take and give time for you and for interpreters then for then translate everything so that we can feel that everyone is included, and as Dr. Hans said, that no one is left behind. And I kindly ask your support and willingness to collaborate in good and respectful spirit. I already have felt that during the first part of this session. And I also appeal you will show indulgence for temporary suspensions of the sessions for consulting the Secretariat and legal. To go further, I would first like to invite the initiator of this request and of the draft resolution to take the floor. Can I invite the delegate from Ukraine, Ministry of Health, Dr. Liashko, to address the regional committee? Please, the floor is yours.
Dear participants of the colleagues, partners, I want to begin my speech by those who support Ukraine in this difficult time, those who provide humanitarian aid, those who take in seriously ill Ukraine, those who care about refugees forced to leave Ukraine, fleeing from the horrors of those who visited Ukraine at this difficult time, the horrors of the war with their own eyes. And this is Director General, Director of the WHO and Lithuanian Minister of Healthcare, Mr. Dalkis. Believe me, Ukraine deeply appreciates the support. I would especially like to thank those who supported Ukraine's call for the special session and condemn those who forced us to hold it, the Russian Federation, Belarus. I would like this special session country's success in ensuring universal access. That's what we agreed when I was appointed. We could also demonstrate our breakthrough in achieving the third goal for sustainable development in nations, to ensure a healthy lifestyle. New tragic date came in 2024. The Russian woke up the whole of Ukraine with hundreds of missiles at that day. We had terrible explosions after the Second World War. The Russian Federation then launched a full allowed to Ukraine. Stop the war. For 76 days in a row, Russian terrorists have as of now 600 medical damaged. 200 ambulances deliberately shot. Behind every in these figures, there is a life in the hospital and had nowhere to go. Russia totally disregards all norms. Waging this war war that grants on global security and peace. So the same that has been invaded and suffers on a basis and extreme without regard to correct name. I'm grateful to the World Health Organization. The rhetoric since February digs all humanitarian principles, uses to danger 1 out of 5 and clear war. Of this war in Ukraine has possible. However, reason for excuse today we can get the same support in healthcare. Our simple. We all need to understand is a stain insult to the work of they were cynically killed. Will not do it today. Will invite you to the opportunity to just look them in the. Believe me, these emotions will that I can add. Have been implemented by the W. This is, for example, a food policy, and stolen from the occupied south of, and dozens of nations are now have recently considered Turkey. So I'm become a reality. We propose a recommendation for children health lifestyle killed in the war and survived by territories, and this is the issue of after the loss of limbs and demand and the mining, and the consequences of mine injuries will be felt for at least executions and already Ukraine and real threat. This could be could go on and on. Sure, or whether through regional office, a brutal game of Russia. So with a proxy way of appeasing the aggressor, which, as history teaches us, only makes the situation worse. The resolution emergency situation in the field of healthcare in Ukraine and neighboring countries caused by the aggression of the Russian Federation is the smallest step we can take to present our stance. We call on all members states of the European Regional Committee to support and the draft resolutions submitted on behalf of the EU countries and the UK, Albania, Andorra, Icelandia, Ampora, Norway, San Marino, Turkey, and others joined this, and many others joined today. So I'm calling upon all the members of the European Regional Committee, please support the draft resolution thus submitted. The aggressor state must understand that the period of impunity for its actions is over. Europe is a symbol of freedom, a symbol of liberty, a symbol of honesty. Support Ukraine, and in this way, you will support the whole world. Thank you very much for your attention.
Thank you, Dr. Liashko. I now give the floor for Russian Federation.
Господин председатель,
Mr. President, Mr. Director General, dear colleagues, can I first of all extend my warming welcomes to all of you today. Yesterday, we celebrated in Russia, as in other countries, the great victory over Nazis. Many of our fellow citizens gave up their lives so that these events would not repeat themselves. Our country greatly values international cooperation within the WHO, including in the European framework. We have always been dedicated to consensus, and we have always fought against politicization of any issue. But we are seeing something different today. Ukraine and 43 countries of Europe are initiating a meeting, not just to facilitate the situation of people in Ukraine and other countries, but so as to stop cooperation with Russia and worsen the situation in Ukraine. This is clearly political and an unacceptable way of doing so. The situation in healthcare in Ukraine and other neighboring countries, including Russia, is difficult. Let me remind you of the purpose of the WHO, providing healthcare to many. The population of Ukraine has been divided into the right kind of people and the wrong kind of people, divided along political and linguistic lines. This has threatened access to healthcare, but not only to healthcare. It has threatened the life of people. Dividing these people is not acceptable or proper. This leads to segregation, segregation we haven't seen since World War II. The exceptional situation in Ukraine and surrounding countries started much earlier, in 2014, when Kiev led a military aggression against its own people in the Donbass. Dr. Tedros, yes, war is awful, but the people of the Donbass have been in a state of war since 2014 and experiencing their consequences. The people who live in the Donetsk and Lugansk People's Republic have lost almost all access to services in Ukraine. And talking about conditions, about the chronic diseases leads us to recognize that the situation has worsened. Over the last 8 years, as is still the case today, medical facilities have been targeted and destroyed. In the territories under the Ukrainian armed forces, a number of facilities and old people's homes also have been threatened. In Konstantinovka in Donetsk Republic, the hospital has been attacked and cleared of all its patients in a cynical move. And Ukrainian armed forces were settled there, including by establishing military positions and having guns. In the 5th of May, we saw what happened in the Azovstal facilities in Mariupol. Bombing civilians is something that has been done by the Ukrainian armed forces. Since 2014, following such bombings in the Donetsk and Lugansk People's Republic, 80 facilities have been bombed in Lugansk. 19 such facilities were destroyed or almost destroyed in Donetsk Republic. Dear colleagues, in these shootings and bombings, many civilians, including healthcare workers, have died. Medical help is almost unavailable now in the People's Republics. Russia, over the last few years, has called for peace, agreeing with international agreements. We've spoken for security, a security that would guarantee peace and safety for civilians and all the population. Our initiatives were met with silence. In accordance with the UN Constitution, the Russian Federation initiated a special military operation in the Lugansk and Donetsk People's Republics. This was the only possible course of action. As concerns access to medical care, Russia is actively restoring and rebuilding facilities. And thanks to our assistance, including the distribution of medicine, of foodstuffs, also the medical facilities in Lugansk and Donetsk have started operating once again and are providing access to healthcare to the people as is planned for in the constitution of the WHO. We have been giving a strong emergency care when necessary to secure the life of people. And such assistance has been provided on site, but also in Russia proper. We are grateful to all the medical workers in the Ukraine, in the Donbass and elsewhere, who are saving lives on a day-to-day basis. Following this humanitarian crisis in Donbass and the Ukraine, more than 1 million people have come to Russia. They require physical and psychological health. They need assistance to be resettled. To avoid the spread of coronavirus and other diseases, testing is being conducted. Can I say that Russia is strictly abiding to the rules that provide for access to military personnel, and the political ambitions of a number of countries in the region are threatening health across Europe. We oppose the adoption of the proposed resolution or its transmission to the World Assembly. We call on further cooperation for the good of people. Thank you for your attention.
Thank you, Mr. Plutnitsky. Let me also refer members to the letter that was sent by the Russian Federation, signed by Mr. Plutnitsky, which can be found on the website. Before opening the floor, let me add the information that Montenegro has also corresponded the proposed resolution just under discussion, and remind you about speaking time limit as agreed upon in our special rules and procedures, that there is 3 minutes for individual statements and 5 minutes for group statements. And I would like to urge delegates to observe these restrictions and will make use of the prerogatives attributed to me as presiding officer to make sure that we keep track of time. A timer will help you to keep an eye on your time left. However, as chair, I have allowed an exception for the members directly involved in this armed conflict, namely Ukraine and the Russian Federation. With this, I now open the floor for other statements and interventions by the other members of this regional committee. So, and I prefer group statements first.
Let's see who puts their hand up. We had promised.
Okay, so in advance, there have been agreement that France, as EU Council President, would deliver a group statement on behalf of the EU. So the floor is yours, France.
Merci, Madame la Présidente, Monsieur le Directeur Général de...
Thank you, Madam President, Mr. Director General, dear friends and colleagues. I have the honor to speak on behalf of the European Union and its member states. We are meeting here today in a state of an emergency to look at the heart-wrenching consequences of the unprovoked and unjustified military intervention of the Russian Federation. We would like to thank you for organizing this meeting asked for by the 27 member states of the EU together with Ukraine and others. The European Union and its 27 member states vehemently condemn this flagrant violation of the basic principles of the Charter of the United Nations by a member of the United Nations, member of the Security Council. Can I first of all express our full solidarity for the events? Can I also condemn the flagrant violation of international law, international humanitarian law, the UN Charter and the WHO Constitution, and which is a threat to global health, peace and security and stability in the world. This aggression has led to thousands of victims and to the worsening of the physical and mental health of the people of Ukraine. This aggression has already had a devastating impact on Ukrainian health systems, leading to restricted or impossible access to health services for millions of people. Ukraine's health system is facing many challenges, such as the impact on maternal and newborn health, on people living with HIV/AIDS, prevention of treatment of NCDs, in particular for the elderly, as well as on mental health. We must preserve the fundamental right to health of the people of Ukraine, especially the most vulnerable groups. This aggression also heightens the risk of emergence and spread of infectious diseases, given its impact on vaccination rates, access to water, sanitation, and hygiene. It also raises the risk of human trafficking, gender-based violence, food insecurity, and potential nuclear, chemical, or biological hazards. Deliberate attacks on healthcare continue. We call on Russia to immediately stop attacks on healthcare facilities and to allow the safe evacuation of civilians who wish to leave for a destination of their choice. Free and safe access for those delivering medical and humanitarian assistance must also be ensured. And on behalf of the EU, I convey our solidarity and our deepest respect to all health workers that are working tirelessly to uphold the health of the people of Ukraine. The European Union and its member states stand alongside Ukraine and will do all they can to alleviate the situation. More than 25,000 tons of humanitarian aid have already been shipped to Ukraine. We are also in the EU providing healthcare for those patients that cannot be treated in Ukraine, including, but not only, people with burn injuries or cancer requiring cancer treatment. Mental health service has also been set up, mainly in Ukraine's neighboring countries, to extend assistance to the people requiring assistance. The high-level conference organized by Sweden and Poland and attended, amongst others, by the President of the European Commission, have illustrated what can be done when assistance is extended in a humanitarian crisis. We express our thanks and gratitude to the WHO for what has been done on the ground. Over the last few months, 7 million people or more have been given equipment, medicine, and others conducted by the WHO. This has led to, amongst others, cooperation with the health authorities to avoid as many disruptions as possible, and this must be furthered. We ask Mr. Regional Director whether the call launched on the 25th of April covers the needs of the WHO for the next few months. The impact of the aggression go well beyond the borders of Ukraine and the Europe. We know that this will go far beyond and should be looked at by the World Health Agenda. The EU and its member states therefore fully support the resolution as put forward, the resolution that has been circulated. Regional, local and trans-regional issues must be discussed at the upcoming WHA. With a concern for peace, the EU and its member states are once again calling for Russia to suspend its action and to abide by international law. Thank you.
Thank you, Franz. And I have noticed that there is a group statement delivered by Norway, and after that, following UK. So Norway, the floor is yours.
Thank you for giving me the floor. Director General, Regional Director, Excellencies, colleagues. I deliver this statement on behalf of Iceland and Norway. We align ourselves with the statement delivered by France on behalf of the EU and its 27 member states. First, I would like to thank the Regional Director for organizing this special session on short notice. Ukraine and its population have our full and unwavering support. We condemn Russia's aggression against Ukraine in the strongest possible terms. It is a clear violation of Ukraine's sovereignty and territorial integrity, and a flagrant breach on the UN Charter of an international humanitarian and human rights law. We also condemn Belarus for enabling and assisting the Russian aggression. We are particularly concerned about Russia's attack on civilians and civilian infrastructure, especially attacks on healthcare facilities. Last week, the number of reported attacks on healthcare facilities was approaching 200. These inhuman attacks deprive people of urgent needed care and endanger healthcare providers. We demand the respect for and protection of all medical personnel engaged in medical duties, their means of transport and equipment, as well as hospitals and other medical facilities. WHO and other humanitarian actors must be given the opportunity to provide life-saving health care and services. Attacks on healthcare facilities and workers are violations of international humanitarian law. We commend WHO for its important work documenting these attacks. Those responsible must be held to account. The disruption of the health system in Ukraine endangers maternal and newborn health, management of chronic disease, and NCD, and put Ukraine and neighboring countries at risk of outbreak of infectious diseases such as measles. Refugees are exposed to human trafficking and sexual and gender-based violence. The millions of children that are internally displaced or forced to flee Ukraine are placed in particularly vulnerable circumstances. Their homes, schools, and medical facilities have been destroyed. They are traumatized by the destruction of the places they live, learn, and play. Russia's warfare in Ukraine is also having a serious impact on the global food system and aggressive other health, humanitarian, and refugees crisis. The World Food Programme is reporting additional cost of $29 million per month for food assistance to those placed in the most vulnerable situation. The poorest countries and their population will be the ones who are hit the hardest, as always. We demand respect for the obligation of member states to spare infrastructure needed for food production and distribution, and to help ensure that food assistance reach those in need. We believe that the consequences of the Russian aggression in Ukraine need to be discussed by the broader WHO membership, as they affect millions of people outside the Euro region. As co-sponsor of the draft resolution, we request the regional director to transmit this resolution to the Director General so it can be brought to the attention of the 75th World Health Assembly. We commend WHO for your vital efforts to ensure the provision of essential health services to the people of Ukraine and to support the efforts of neighboring countries to reduce the impact of this war as much as possible. You can count on our continued strong support. Let me end by stressing that we must defend our world order, where relationships between states are determined not on the basis of power, but by international law. The sovereignty, political independence, and territorial integrity of all states constitute the basic principles of the international community, enshrined in the United Nations Charter. Russia must immediately, completely, and unconditionally cease its use of force and withdraw all of its military forces from the territory of Ukraine within its international recognized borders. This is the only way to end the humanitarian catastrophe in Ukraine and beyond. And listening to the statement delivered by Russia today, I would also like to condemn Russia's false narrative. Thank you.
Thank you, Norway. And before giving the floor to the UK, I have got the information that France have asked for the right of reply, and I will give the floor for that in the end of this morning. But now the floor is for UK, followed by Monaco.
Thank you, Chair. Firstly, can I express my thanks to member states of the Euro region for calling this special session today to discuss the health impacts of Russia's invasion of Ukraine. I'd also like to pay tribute to the staff of WHO Ukraine and WHO Euro under the leadership of Dr. Hanno Habich and Dr. Hans Kluge for their bravery and dedication in leading the WHO response. Russia's illegal invasion of Ukraine violates international law. As the UN Secretary General has said, such unilateral measures conflict directly with the United Nations Charter. The use of force by one country against another is the repudiation of the principles that every country has committed to uphold. The United Kingdom therefore stands united with partners in condemning Russia's outrageous attack on Ukraine. As the Director General powerfully noted in his speech to last week's International Donor Conference for Ukraine, the disruption of health services across Ukraine has been catastrophic, and we therefore welcome calls for a full assessment to help us better understand the impact. Life-saving and essential medicines and related items are in short supply. In the immediate term, disrupted health services and unavailable treatments will result in increased deaths, as will reduced access to clean water, sanitation, food, and shelter. Women, children, and people with disabilities are particularly vulnerable in every conflict. Gender-based violence is a grave concern, and there are serious impacts on mental health. Perhaps most egregiously, WHO has confirmed the grim milestone in the last couple of days that there have been 200 attacks on healthcare facilities since the start of the conflict. Violence and lack of access to services is resulting in mass movement of civilians that has further health and humanitarian impacts on neighbouring countries. At a time when the Euro region should be working together to strengthen our health systems and continue to respond and recover to the COVID-19 pandemic, we're instead facing new challenges, including global food insecurity resulting from the invasion. The United Kingdom has been standing shoulder to shoulder with Ukraine and our allies, and has been providing life-saving medical assistance in response to the crisis. This includes £400 million of economic and humanitarian aid and over 5 million items of medical equipment and supplies delivered. But we must do more. As all those listening will know, the UN estimates that overall over 24 million people, more than half of Ukraine's population, will need humanitarian assistance in the months ahead. With all of this in mind, we fully support a full assessment of the health emergency and its local, regional, and global impact, which we feel is needed urgently and must be considered at the World Health Assembly. The United Kingdom's position is clear. This unprecedented resolution should be adopted. Thank you very much.
Thank you, UK. Next, I give the floor to Monaco, followed by Serbia.
Je vous remercie, Madame la Présidente.
Thank you, Madam President. Madam President, this war is not sparing either civilians or civilian infrastructure, and in particular, the health infrastructure. We have gathered today as a war is raging in Europe, a war that was born of the invasion of Ukraine by the Russian army. Here, we would like to speak about our solidarity and the solidarity of the Principality's government with the Ukrainian people. We condemn all attacks perpetrated since the beginning of the invasion against civilian population and health population, as well as infrastructure and health transportation. The Geneva Conventions define very clearly the rules which must be applied, including having to do with wounded combatants. The Principality of Monaco is calling on full respect of international humanitarian law. This war has destroyed and disorganized a large part of the health system in Ukraine. And it has also had an impact on those neighboring countries that are the first to welcome refugees from Ukraine and who need long-term healthcare for wounds, vaccines, as well as mental health care. This session is allowing us, therefore, to gather, and we would like to thank the WHO, and in particular WHO Euro, for your mobilization. Monaco has co-sponsored this resolution, and we feel that it is indispensable, and it is something that will help us with long term. We would also like to support what has been said by France, Norway, and the United Kingdom. And this is why we feel that this particular session has been very much needed, and we are very much thanking the WHO for mobilizing their efforts. Monaco has co-sponsored this resolution, and we feel that it is indispensable to talk about this during the WHA, including the health situation in Ukraine as well as in the neighboring countries. Thank you.
Thank you, Monaco. Next, Serbia, followed by Israel.
Thank you, Madam Chair. Mr. Director General, Dr. Tedros, Mr. Regional Director, Dr. Kluge, distinguished participants. I have the honor to address this special session of the WHO Regional Committee for Europe on behalf of the Republic of Serbia. Based on its own experience with the consequences of war conflicts, the Republic of Serbia is fully aware of the importance and need to provide humanitarian aid, including the right to health protection to all those in need, in particular to the exceptionally vulnerable groups of the population. I take this opportunity to reiterate that Serbia is firmly committed to the respect of the principles of the international humanitarian law, including the protection of all medical and humanitarian personnel engaged in medical duties in the conflict zone. Over the past 2 years, we have been witness to the fact that only solidarity and joint activities of states based on the recommendations of the WHO bear positive results in the fight against the virus. To that end, today we call for solidarity and joint action of all humanitarian stakeholders engaged in managing the consequences of the conflict in Ukraine. We believe that these universal type of issues should be above all the political matters and divisions. Distinguished representatives, since the beginning of the conflict, the Republic of Serbia has been giving special attention to its consequences to the civilian population, in the first place, to the grave humanitarian and health situation, and to the increase in the number of refugees and IDPs. We therefore deem necessary to create conditions for the delivery of humanitarian aid and to support all efforts aimed at putting an end to the conflict. I take this opportunity to announce that at the International Donors Conference for Ukraine held on 5th of May in Warsaw, Poland, co-organized by the Prime Minister of Poland, Mateusz Morawiecki, and Swedish Prime Minister Magdalena Andersson, in cooperation with President of the European Council, Charles Michel, and President of the European Commission, Ursula von der Leyen, the Republic of Serbia pledged to donate humanitarian aid of 3 million euros for children, as well for displaced persons inside and outside Ukraine, that will be directed through the UN system, of which 1.5 million euros through the United Nations International Children's Fund, UNICEF,
and 1.5 million through the UN High Commissioner for Refugees. In addition to that, on 27 February 2022, the government of the Republic of Serbia adopted a decision of sending humanitarian aid to the endangered population of Ukraine and activated for the first time the interim protective mechanism for displaced persons coming from that country. In conclusion, the citizens of Serbia sympathize with the citizens of Ukraine in their wish to return to normal life in which future generations will live without the fear of war. I thank you for your attention.
Thank you, Serbia. Now I give the floor to Israel, followed by Albania.
Dear ministers, ambassadors, dear friends of the WHO, and especially dear Dr. Kluge, the Russian ongoing attack on Ukraine is a serious violation of the international order. Israel continues to condemn it and calls upon Russia to stop the attack and respect the territorial integrity and sovereignty of Ukraine. Israel remains concerned over the impact on civilians, including the significant number of civilian fatalities and mass displacements. The human rights and health of the Ukrainian people must be respected and protected. The Russian invasion has had a devastating impact on Ukraine's health system and has severely restricted access to medicines, facilities, and health services for the Ukrainian population. The war has also disrupted vaccination campaigns. Israel is concerned about the impact this has on efforts to tackle non-communicable diseases and chronic infectious diseases such as HIV, and tuberculosis. Israel has also notes with concern that the WHO has confirmed over 100 attacks on healthcare personnel. Reduced healthcare and medicines due to hostilities are likely to worsen the health status of the Ukrainian population. In addition to this, mental health and psychological needs of the Ukrainian people are intensifying, and the COVID-19 situation remains fragile. I myself was a witness to all that when I visited the Ukraine last month and talked to many refugees. These people were treated by Israeli medical staff at the Kochav Meir, or Shining Star Center in Mostiska, Ukraine. Israel established this medical center in response to the ongoing attack. Also, over 6 weeks of operations, we treated over 6,000 patients, carried out 21,000 lab tests, analyzed 800 diagnostic images, performed 40 surgeries, and even delivered 1 baby. We heard terrible stories from the patients who got care in this center. Also, I should notice that Israel has provided over 100 tons of humanitarian and medical assistance to the people of Ukraine. Bottom line, Israel will continue to do all that it can to assist the well-being and health of the Ukrainian people. Thank you very much.
Thank you, Israel. Now I give the floor to Albania, followed by Belarus.
Thank you, Madam Executive President, dear Director Regional, Dr. Hans Kluge, distinguished participants. Albania has supported the holding of this Rule 5 session of the Regional Committee to discuss, as a matter of urgency, the impact of the Russian aggression against Ukraine on the health conditions in Ukraine, as well as its consequences on health matters within the European region as a whole, and on international health matters further afield. 2.5 months into the unprovoked, unjustified, illegal, and deadly aggression by Russia, The humanitarian consequences are dreadful. Massive civilian casualties, mass graves, widespread destruction of civilian infrastructure, ruined homes, schools and hospitals, lives blown away by bombardments. Several appeals for humanitarian corridors to evacuate civilians went unheeded. Many people remain trapped in areas of conflict and, with essential services disrupted, are unable to meet their basic needs, including food, water, and medicines. The Russian aggression against Ukraine is not only a blatant breach of UN principles and international law, but it also had severe humanitarian consequences for the people of Ukraine and negative effects in Europe and further afield. As a non-permanent member of the Security Council, Albania is at the forefront of the international response to the Russian aggression and its terrible humanitarian consequences. Albania will continue, along with like-minded countries, to include the situation of Ukraine in UN Security Council and other UN forums, closely following the developments on the ground. As a co-pen holder with the United States for Ukraine and in coordination with other partner countries, Albania is giving a real contribution as the initiator of the meetings of the UN Security Council on Ukraine and in drafting of documents that will be submitted for discussion in the Security Council. Albania has also been vocal and active in the meetings of the UN General Assembly, as being one of the initiators of convening the special emergency session of the General Assembly on the situation in Ukraine, mandated by a special resolution of the Security Council presented by Albania and the United States. Albania's main focus has been on political, humanitarian, civilian protection, including women and children, and accountability. To this end, let me conclude by expressing Albania's full support to the request by a group of countries to convene with the aim of considering the situation in Ukraine and putting forward a draft resolution on health emergency there and neighboring countries. Albania also welcomes within this framework the initiative of tendering an appropriate advice on the international health aspects of the Russian military aggression in Ukraine and the consequences it entails, which clearly have wider than regional significance, especially in Europe. I would like to stress further support for the time frame proposed in the above-mentioned request. On a final note, I would like, on behalf of Minister Ogerta Manastirliu and the Albanian authorities, to express our appreciation for the efforts and the work done so far by Regional Director Hans Kluge and his team in terms of emergency response and relief assistance on the ground to the Ukrainian government and people. We encourage further resolute action in light of the special session, as well as in accordance with WHO mission, the overall goals and strategies standing at the foundation of the organization and the policies it seeks to implement. Thank you for your attention.
Thank you, Albania. Next, we have Belarus, followed by Switzerland.
Thank you, Madam Chairman. Dear colleagues, unfortunately, we see that we have a crisis very close to our borders in the Ukraine. And we have here an opportunity to discuss things and hope come to a peaceful situation. We support the strengthening of the Ukrainian facilities to extend assistance to the victims and to the regional health systems. We know that the situation is very difficult both in the country and outside the country. As a brotherly country, we extend our assistance in terms of medicine and medical care to Ukraine and neighboring countries. We are ready to make available some Ukrainian facilities. In this respect, we are happy to cooperate with the UN, including with WHO. We recognize that increased pressure on the medical systems and healthcare systems in our countries is increasing, and we need to make sure that there is still access for population. We need to try and do our utmost to ensure provision and delivery of medicine, affordance of technical medical assistance to the people who require it. We speak against the misuse of medical facilities to house military units and thus put at risk the people's lives, including medical and healthcare workers. We recognize that Russia has always extended clear and technical assistance to all in relation to the NCD office. Can I once again say that the joint efforts to extract civilians from Mariupol illustrates cooperation. We should therefore make further efforts. Can I also add that Belarus is not a war belligerent in these circumstances? The president of Belarus has made tremendous efforts to make sure that contacts could be maintained between the West and the president of Russia. We need to recognize also that the situation in Russia is deteriorating somewhat, and therefore putting at risk also the possibility of cooperation. The proposed and draft resolution does not bring any specific contribution to the situation. We, therefore, on behalf of Belarus, do not support the draft resolution proposed. Thank you.
Thank you, Belarus. Next, the floor is for Switzerland, followed by Turkey. Do we get connection to Switzerland?
Madame la Présidente.
Madam President, Switzerland should like to thank the Secretariat of the Euro region for organizing this extraordinary meeting. We express our solidarity with all the victims of this military attack, which we condemn strongly. Switzerland will go on acting unreservedly for the health of our people across the region. We therefore support the text. May I make two short comments? First of all, protection and respect for the injured, the sick, and health workers, and for their means of resources, their equipment, hospitals and other military medical facilities are at the heart of international humanitarian law and have been reaffirmed in Resolution 2286 of the General Assembly. We therefore call on all to abide by these rules and standards and avoid any attack against healthcare facilities, and to support the WHO and other organizations in what they do to collect data on such attacks. Secondly, Switzerland particularly supports the operational paragraph in the resolution relating to a report on the health situation in Ukraine. You will remember that at the last session, the CBCR had indeed heard such a request. It must be submitted to the World Health Assembly. Thank you.
Thank you, Switzerland. We have got another right of reply here from Russian Federation, and that will then be delivered in the end of the morning meeting. And now the floor is for Turkey, followed by Tajikistan.
Madam President, Excellencies, Mr. Regional Director, dear colleagues, we thank Dr. Kluge for convening this special session of the WHO Regional Committee for Europe upon the request of 43 member states of the region. The member states, as we heard in the detail from the DG, Dr. Kluge and WHO representative, the impact of this war on health conditions in Ukraine and in the surrounding region is alarming. We are deeply concerned by the disruption of health services across Ukraine and the collateral effects of this crisis on the overall health condition in our region and beyond. Treatment of patients with chronic diseases, maternal and newborn health, conflict-related injuries are matters of utmost urgency. The ongoing COVID-19 pandemic and the real risk of infectious diseases couple this grim situation. The shortages of medical supply and challenges to accessing healthcare are doubling the health risks on the ground. Women, children, elderly, people with health conditions and disabilities, refugees, internally displaced persons, and all civilians are bearing the heaviest burden when it comes to the consequences of war. The aggravation of mental health and psychosocial health is worrying, and it will have even a greater cost in the years to come. We are also extremely worried about the verified reports on attacks on healthcare. Healthcare facilities and all civilian infrastructures cannot be a target and must be protected. International humanitarian law must be respected. Respect to territorial integrity and upholding basic principles of international law must be at the core of our all efforts. Turkey has always supported Ukraine's sovereignty and territorial integrity, including Crimea. Madam President, safe and unhindered humanitarian access, including for medical personnel and medical supplies, should continue, especially for the harder hit areas, and reach all those in need. Safe passage for civilians and humanitarian personnel must be guaranteed, for that the cost of this war not be further loaded upon the innocent civilians. Right to life is a fundamental right and also the foundation to attain health and well-being, which is our common goal as it is established under the WHO Constitution. While we continue to call for a lasting ceasefire as soon as possible, mitigating the devastating humanitarian consequences of the conflict is of utmost urgency. We commend the WHO and all the humanitarian partners on the ground for their tireless efforts to support healthcare and deliver humanitarian assistance in Ukraine and for the refugees in neighboring countries. Madam President, we maintain our view that this conflict can only be resolved politically through negotiations. Since the start of this war, we have been actively working to facilitate diplomatic dialogue. Meanwhile, humanitarian assistance operations are being carried out by Turkish institutions and organizations, including the Ministry of Health and the Turkish Red Crescent. We are also contributing to support humanitarian efforts and offering shelter to Ukrainians forced to flee their homes. We strongly believe that diplomacy is the only way out, and we will continue to call for a peaceful resolution. I thank you.
Thank you, Turkey. Next, I give the floor to Tajikistan, followed by Montenegro.
To Mr. Kluge, dear colleagues, the situation is very painful to look at, and we express our pain, our shared pain with all those who have been affected. We empathize in these very difficult situations. We share in the pain of Ukraine and Ukrainians who require assistance. We have experienced war, civil war in our country, and we know how difficult these circumstances, such circumstances are. We know that the resources, in the current circumstances, the resources and the experience of the Russian Federation should be relied upon. We need to be very mindful and careful in our analysis of the situation to describe and outline the best possible path. We support Russia and its provision of humanitarian resource assistance. Any assistance that is given must be focused, and in this respect, therefore, we do not support the current initiative. We do not agree with it, and we feel that this may lead to escalation of tension that would be beneficial for no one. We need to try and solve the situation through negotiations. We shouldn't deprive ourselves of experience and resources. As I come to a close, I'd like to thank the WHO for the quality of the assistance, medical and technical, that it extends across the world. We must make sure that any assistance afforded to those fleeing the country can reach them effectively. Thank you.
Thank you, Tajikistan. Next, Montenegro, followed by Bosnia and Herzegovina.
Honorable Regional Director, delegates, ladies and gentlemen, we thank the Regional Director for his fast response to the letter from the 28th of April 2022 and the invitation for the special session. Montenegro has been straightforward in its stand on the matter in Ukraine. For Montenegro's government, peace has no alternative. The aggression has a devastating impact on Ukraine's population and a health system. The impact of aggression on neighboring countries is also immense. Moreover, the consequences for the health system are huge and cause disruption of essential health services and vaccination campaigns. The war displaced for more than 12 million people. Montenegro has opened the doors for refugees from Ukraine. The government of Montenegro has adopted the decision and granting temporary protection to persons from Ukraine, assisting people in need and providing protection and assistance. The enjoyment of the height attainable standard of health is one of the fundamental rights of every human being. Attacks on healthcare facility and health workers directly impact people's ability to access essential health services, especially women, children, and other vulnerable groups. Peace is a structural determinant of health, while conflict has a devastating impact on people's health and on health systems. The mandate of the World Health Organization is clear, and Constitution recognizes the link between health and peace, setting forth that the health of peoples is fundamental to the attainment of peace and security. One more time, for Montenegro's government, peace has no alternative. Thank you very much.
Thank you, Montenegro. And next, Bosnia-Herzegovina, followed by Armenia, and then I don't have any more asks for the floor. So now the floor is for Bosnia-Herzegovina.
Thank you very much. Dear Director Kluge, distinguished members of the WHO Regional Committee for Europe, it is my great pleasure to address you on behalf of the Ministry of Civil Affairs of Bosnia and Herzegovina on this important topic discussing emergency situation and health needs of Ukraine. We are all witnessing the joint effort of cooperation of member states of the WHO Regional Committee for Europe to preserve peace and prosperity, manifesting solidarity in these challenging times. Conflict and insecurity, IDPs, refugees, injuries, deaths of civilians, and devastation impact the war has on health condition in Ukraine is what is a war about. Evoking memories of our recent past in my country too. Bosnia and Herzegovina is a country with strong commitment to become a member of the European Union, sharing European values of human dignity, liberty, democracy, solidarity, rule of law, and respect for human rights, is giving full support for the adoption of the resolution we are discussing today. Through this resolution, we are reminded of our commitment and principles set in the Constitution of the World Health Organization, which are accepted by all member states. We are highly concerned over the ongoing health emergency in Ukraine and neighboring countries. Nowadays, it is very important to ensure respect for international humanitarian law, including protection of all medical personnel and humanitarian personnel, inclusively engaged in medical duties, as well as hospitals and other medical facilities. On this occasion, I would like to thank you for your attention and wish to all of us a successful work. We are looking forward to continuing to work with member states of the WHO Regional Committee for Europe to uphold values of the international system and support the Ukrainian people. Thank you.
Thank you, Bosnia-Herzegovina. And then the floor is for Armenia.
Thank you. Dear Ms. President, General Director, Regional Director, delegates, colleagues. We took the floor to emphasize that Armenia remains concerned about conflicts and confrontations in Europe. We regret the loss of life and the damage to the security environment, which has detrimental effects also on the general healthcare situation. Everyone is entitled to the right to health. This is even more pertinent to the people living in the conflict zones. Their rights and freedoms, their dignity and health should be protected. The World Health Organization should have unimpeded access to any conflict zone and strive to protect people in health emergency situations. At the same time, we must highlight the existing positive cooperation with the WHO European Office for the Prevention and Control of Non-Communicable Diseases. Armenia is a beneficiary of the technical assistance provided by the office, which is an invaluable asset to the efforts undertaken by the health authorities of the country. Armenia is of the view that we should strive not to impair the activities of the office, and in this respect, we are not in support of its relocation. Thank you.
Thank you, Armenia. Before I close the list of speakers regarding this general debate, may I ask if any other delegates wish to speak here regarding the general debate before we go to the consideration of the proposed draft resolution? If not, I would also remind you that all participants, including observers invited to this special session, can submit written statements. You will find them on the website. And then there also has been some speakers who have set questions to our regional director, and I would now like to invite you, dear Hans, to answer to those questions.
Thank you, Ambassador. I think the key question was for Professor Jérôme Salomon. Thank you so much, Professor. Whether the appeal which was out was covering all the resources. So actually, the gap is still 53%. So the gap is about $100 million, and the most acute needs are air trauma and life-saving medicines and medical supplies, but also the non-communicable diseases, mental health services, and maternal and child health. So this is for within the Ukrainian, but I would like to take the opportunity, and thank you again, Professor Salomon, for giving me this opportunity, that we had agreed at the Regional Committee on the regional plan of implementation, 2 years to implement the European program of work, and that we desperately need to scale up the broad public health agenda. We had 2 terrible years of the pandemic. We need to continue to working very, very hard on the health needs and the humanitarian assistance in the context of the war in Ukraine, but we also really need to continue to work with the broader public health agenda, which, as we know, is a lot about the non-communicable diseases. The JDO on NCDs in Moscow was mentioned several times. And of course, depending on the resolution, then the region director will have to seek the best advice and consult, including with potentially legal and other ramifications, particularly with the standing committee of the region committee chaired by the Global Health Swiss Ambassador Nora Kronig-Romero. But let me have some points here on the WHO European Office for Prevention and Control of NCDs. It represents a strategic investment by the European region to tackle NCDs, which are the largest cause of premature mortality. Europe is the only region with a dedicated office for NCDs, with additional resources for NCD technical support through the WHO European Office for Prevention and Control of NCDs. We have already seen the return on this investment, as before the pandemic, we were making significant reductions of premature mortality from NCDs, as specified in the SDG target 3.4. And the NCD office carries forward WHO Europe work related to all NCD risk factors: tobacco, alcohol, nutrition, obesity, and physical activity and NCD data surveillance. And the funding responsibility currently borne by the Russian Federation amounts to $26.5 million through 2024. The NCD office hosts also the following member state networks. Number 1, the WHO European Salt Action Network. Number 2, the Reducing Marketing Pressure to Children. Number 3, the Health Enhancing Physical Activity Focal Point Network. Number 4, the Physical Activity Researchers Network. And number 5, the CIS Alcohol Policy Network. Prior to 2015, there was a major gap in the NCD data from CIS countries. Very important NCD surveys such as STEPS and COSI were conducted in CIS countries. Now these countries have very high quality, globally comparable data to inform policies and monitor NCD targets. Childhood Obesity Surveillance Initiative is the largest childhood obesity surveillance in the world, with more than 1 million children measured. And the current activities and extension of the survey is supported by the grant. STEPS is the only adult survey conducted by Euro, important for NCDs, but also for primary healthcare, universal health coverage, and mental health. So I thought too, this number of points I wanted to take forward for the consideration of everyone. Thank you.
Thank you, Regional Director. We have had a lively discussion regarding the general views of the suggested resolution. I would now go to the consideration of the proposed draft resolution, and I have noticed that there still is some countries who would like to have the floor for further specific comments to the resolution before we continue to adopt it. I would now give the floor first to France on behalf of EU, followed by Russia, and after that, Ukraine. So, France, you have the floor.
Je vous remercie, Madame la Présidente.
Thank you, Madam Chair. Mr. Regional Director, Dr. Kluge, I'm speaking on behalf of the European Union. The European Union and its member states have co-sponsored this resolution proposed by Ukraine, and we're satisfied to see a great majority of member states of the OMS have voted in favor of it. And because of this act of aggression that's unprovoked and unjustified against Ukraine, with the horrible health consequences of Russia and its support are isolated from the international community. That is why we would ask one of its members, Russia, to immediately cease its military action and respect international humanitarian law. It must cease deliberate attacks on healthcare centers and ensure safety of medical personnel and humanitarian personnel.
I would like you to focus on the comments on the resolution, please.
Merci, Madame la Présidente. Je commentais effectivement.
Thank you. I was commenting on this resolution. So through this resolution, the members of the Euro region are supporting the WHO, given the direct and indirect impact the attack is having on this region, and especially given the health impacts going even beyond the Euro region. That's why with this resolution, we, the members of this Euro region, are asking that you bring this resolution to the attention of the World Health Assembly. And we also ask that a report on the assessment of the emergency health situation in Ukraine and in the neighboring countries, and measures taken by the OMS and its partners be presented at the 75th World Health Assembly at the end of the month in Geneva. We eagerly await this session of the World Health Assembly and the next meeting of the Regional Committee of the Euro in September in order to be able to continue the assessment of the situation, possible action that we can decide upon. Thank you.
Thank you, Franz. Next, I give the floor to Russian Federation, followed by Ukraine.
Уважаемый господин председатель,
distinguished chair, distinguished regional director, distinguished colleagues. Exercising my right to reply, I'm first of all addressing the participants of this session, those who
This is not the place for the writer of the reply. We are still discussing about the consideration of a proposed draft resolution, and the end of this, after the adoption discussion, I would then give the floor for the rights of reply. So if there are any further specific comments you would like to give for the resolution before we continue to the adoption of it. So that is what I ask you to do.
Уважаемый господин председатель,
Madam Chair, distinguished regional director, distinguished colleagues, we would like to take the floor on this resolution concerning Ukraine. Thank you.
Okay, you have the floor for that, please.
Уважаемые коллеги, я выступаю на русском языке, чтобы еще раз
Distinguished colleagues, I will speak in Russian, which will confirm that everything that Russia is saying here at this session has no basis in reality. Nobody is persecuting anyone in Ukraine. And I will speak in Russian to be heard in Russian. And I'm very grateful to all countries who are here at this session to support Ukraine and are now condemning the actions of the Russian Federation, because what the Russian Federation is doing is a violation of all international norms and standards. It is dropping bombs that are landing on our hospitals. We have facts that have been documented by international observers. So what has been said by the Deputy Minister of Healthcare of the Russian Federation is a lie. You can come to Ukraine at any time. I will meet you and I will take you to a hospital that provides medical assistance to all who need it. For all those who need it, including Russian military service personnel who have been injured on the territory of our country and who have ended up in our hospitals. But you can never go to a hospital that is where our captives are being held, because the Russian authorities will not allow this. And just like they are not allowing Ukrainian humanitarian corridors to get through with medication such as insulin. They are creating a humanitarian disaster. And when they say they are providing humanitarian assistance, this is another law. And they have destroyed a water tower in Nikolaev, and we haven't had water for a month in daycare centers, in schools and hospitals. This is something that has to be seen and heard. And if you know that all this will end with Ukraine, you are mistaken.
Thank you. Okay, perhaps I haven't been clear enough to describe of how we continue here this, and I heard quite clearly from Russian Federation, but also from Ukraine, that your comments are more like rights of replies, and I would be pleased to give you both floor then in the end of the morning meeting here, so that you can then continue and finish your comments there. So I would now ask if there are anyone.
Уважаемый господин председатель.
Distinguished Madam Chair, distinguished Director General, allow me on the draft resolution to say something. On the draft resolution, if you would allow me, we consider that this is a gross violation of the Constitution of the WHO to talk about stopping all the temporary meetings, and putting off or canceling these meetings is going to affect the healthcare system and the countries that are getting consultative assistance, and also trying to continue this technical assistance. And also when we talk about the remote geographical centers and offices that are outside of Russia, these offices are working well in Moscow in keeping with the agreements for cooperation between Russia and the WHO signed in 2014. And Russia has not violated this and is carrying out the project. Suspending the work of these geographically dispersed office will cause suffering and is not a way to help resolve the situation. And we are against adoption of this draft resolution sent to the Director General of the WHO. The Russian Federation is against this draft resolution, and we want recorded that this resolution has as its purpose the destruction of international relations in healthcare within Europe and the WHO. And this resolution is going to compromise the assistance that the Russian Federation is giving to those who need it. Thank you.
Thank you. So, if there is no one who would like to now focus and have comments on the resolution, before we continue to the adoption, I would propose that we can then go to the adoption of the resolution. I have heard much support for the resolution, but a small number of member states are opposed. May we proceed to adopt the resolution with a vote, without a vote, noting that those member states who wish may express their dissociation. So maybe we proceed to adopt the resolution at that basis, and knowing that those who will can express their dissociation straight after that. So. Okay, so the resolution is adopted. Then, are there anyone who would wish to take the floor? I see Russian Federation. Please, the floor is yours.
Уважаемый господин председатель, уважаемые коллеги.
Distinguished chair, distinguished colleagues, we suggest that this question be put to a vote, and we will vote against it.
Okay, so I just adopted the resolution. Let me now have a temporary consultation suspension here. 5 minutes, please. You can have a healthy break from screen that time. back from our short break. I hope you are all there participating. So I'll explain you now what happened. So we got, and I didn't get the information before I announced the adoption of the resolution, that the Russian Federation had then sent a message and contacted us via the hotline that they couldn't, they had technical problems to raise their hand. So accordingly to that, the resolution was not adopted. And therefore, we have to now take the voting. But because our interpreters need an hour break, and we can't be sure that the voting would go then in an hour, so I suggest then that we have now the rights of replies here, because this is the end of the morning meeting. And I have on my list here France and Russian Federation, because I interrupted your both because your comments were more like rights of reply. So I would like now to give the floor for you. And then after those right of replies, we will have an hour break. It has been really a hard 3 hours for our interpreters, and they really have the right also to have their pause for this. And we will be back at 1 o'clock. I ask you then to be back at 1 o'clock so that we can then have the voting. And I really need you all then here so that we can go through the voting. But now, before we end this morning session, I would like to give the floor for France and Russian Federation for the right of reply. And first, the floor is for France.
Merci beaucoup, Madame la Présidente. Mon intervention.
Thank you very much, Madam Chair. Yes, my my statement before was on the resolution. This is the right of reply in reaction to the statement just made by Russia, and to complete the statement already made by the European Union on behalf of its 27 member states. I have the honor of speaking on behalf of the European Union and its member states. First of all, the European Union resolutely supports Ukraine's right to defend its territorial integrity and population under UN Charter Article 51, and also the WHO has already documented 200 attacks on healthcare centers, and we have other figures with regard to, for example, in March, the maternity ward in Mariupol, and the international community must insist that this come to a stop. We ask that Russia stop attacking medical centers and medical personnel to enable them to work in safety, and humanitarian corridors have to be created and respected with all that entails. Safe access to humanitarian assistance in keeping with international humanitarian law and human rights at all times. Russia has to respect international humanitarian law. With regard to Russia's comments on the politicization of the WHO, and we are all extremely concerned by the Ukrainian population's suffering, and Hans Krug, the Director General of WHO, have themselves gone to Ukraine to see what is happening and to support the medical and humanitarian workers working there. The WHO has made an emergency appeal, and there's been $2 million that have been collected for this. And the EU does not think that the Russian Federation's suspension in attendance to conference, etc., and the European Bureau until a peaceful resolution to this conflict can be found, and until that time when Russia will withdraw its military forces. This is not violating the constitution of the WHO. This unprovoked and unjustified aggression of the Russian Federation is a flagrant violation of the UN Charter and WHO Constitution, and we are firmly convinced that attacks on civilians, medical centers, and medical personnel are not conducive to attaining Article 1 of the Constitution of the WHO. There is a health emergency caused by this unjustified attack, and this is something that we are looking at, and Russia has to stop this disinformation campaign with regard to this war, because if we want to go forward in international cooperation, this is very important in health and humanitarian work in the European region with the Secretariat and its 53 member states. Thank you very much.
Thank you. And now, right of reply from Russian Federation. Floor is yours.
Уважаемый господин председатель, уважаемый региональный директор.
Distinguished Chair, distinguished Regional Director, distinguished colleagues, I will exercise the right to reply. First of all, we want to appeal to our colleagues who today, with great passion, have been accusing the Russian Federation of crimes. And I want to once again say that Russia's actions at this point are determined by the need to protect the population of the Lugansk and Donetsk republics, because there was an agreement on cooperation in 2002 with these areas. And since 2014, for 8 years, people have lived in a state of war. And all those who are signing this agreement, including the participants to the Minsk agreements, have not paid any attention to the Donbass conflict and the suffering of the people of this region. And all these years, millions of residents of the eastern part of Ukraine have been subject to unprecedented psychological pressure, and civilians died, were injured, a great deal of casualties, deaths among women and children as well. The armed groups of Ukraine destroyed not just homes and people and social infrastructure, but also hospitals where people were supposed to receive medical care. Several times, humanitarian missions of the Russian Federation and other international organizations were interrupted. Nevertheless, here we have heard many times people accuse us of lies, and the result is a spread of infectious diseases, increase of NCDs. But at the international level, people prefer to be silent about that and not to discuss this topic. Yet, because of this negligence, countries of Europe are looking at Russia, and we have seen the greatest influx of refugees. Hundreds of thousands of people have come into our country, and we've seen the consequences of this entire situation, which has unfolded in the eastern part of Ukraine. People have come with infectious diseases and have hepatitis, HIV, and other infectious and non-communicable diseases. And in that situation, the Russian Federation and its healthcare system have been experiencing this extreme burden. It's an unprecedented burden on our healthcare system. We have mobilized our resources and we are providing the necessary diagnostics and extreme and emergency help to those who need it, those people who had to leave the Donetsk and Lugansk People's Republics. On a daily basis, we are saving people's lives and their health where that's necessary. And the healthcare system of any country must think about this, but not about how to politicize a situation in the interest of some political goals. Many of Russia's actions and much of its healthcare have made it possible to prevent more casualties and victims and prevent the spread of infectious diseases. This conflict and this illusion that over 8 years there were no consequences to this conflict in the Donetsk and Lugansk republics. This is not going to lead to a settlement of the problem. We have to look at it holistically, openly, honestly, and discuss it together. The attention of the international community, also including the United States and their allies, they have been engaged in biological activities, as we have heard it discussed at the UN Security Council. And dangerous pathogens have been used, ones that could lead to epidemics, even in the European region. Our homes and our countries could suffer from this. And we have also listened to declarations of a number of countries saying that Russia's special military operation leading to a shortage of food in the world. This is not a topic covered by WHO's mandate, but as we've talked about this, talking about the Donetsk and Lugansk regions, there is a sowing campaign, and we have to think about how the sanctions imposed or measures imposed upon Russia by the EU, these illegally have been imposed upon us. And distinguished colleagues, we do not agree with the text of the resolution. We do not support it. And we would ask that it be recorded that it is aimed at destroying international relations in the region of the WHO, and even as has been said by Viktor Kirillovich, we need dialogue and not just put an end to meetings for different political motives in order not to undermine healthcare systems for the benefit of all citizens of the planet. We would also like to say that we have not received an answer. We would like to be able to comment this draft resolution talking about how the entire European region, including Russia, is being impacted by this lack of food being delivered. Thank you.
The debate is now closed, and we will then come back at 1 o'clock and directly go to the voting. But before that, during the lunch break, please go through the document of decision-making and procedural issues at the virtual special session of the WHO Regional Committee for Europe, because there you can see how we invite delegates to and give the voting possibility for everyone. So if you go through those that document, I'm sure that we can go very smoothly then the run through of the voting. Have a nice break. See you all at 1 o'clock. The debate is now closed.